Hello, everyone. Welcome to today's webinar, HIPAA 101, Essential Training for 2025. My name is Gary Tarazzi, and here with the webinar team at Rectangle Health. We appreciate you taking the time to join us as we've got an informative session lined up and lots to get into to help take the complexity out of HIPAA compliance. This is a 1-hour course valid for 1 CE credit. We are a PACE provider for CE through AGD. In order to receive CE credit, you must attend this webinar in the entirety of its presentation in the entirety of the presentation and participate in the 3 polling questions. We ask that you please allow for 2 weeks to receive your CE credit via email. And we have a lot to cover today, so we ask that you please forward any and all questions to webinar@rectanglehealth.com, and we will respond promptly. I'll drop that email address in the chat here as soon as I pass the mic over to our speaker. And within 24 hours of this webinar, I'll also be sending over the recording, links to our upcoming no-cost CE credit webinars, as well as more details on how your practice can achieve and efficiently maintain compliance, leveraging the right solutions. If you're joining us on mobile, please note the experience is much better from a desktop. You may also struggle to answer the mandatory polling questions, and if you're joining us on audio only or on mobile. With that, it's my great pleasure to introduce our speaker, Erin Mabray, Compliance Product Manager here at Rectangle Health. Erin spent 6 years working in operations for a nonprofit health organization and has spent the past 4 years in product manager roles concentrated on innovative tech solutions and healthcare compliance. In her current role, she oversees technology and product improvements for one of the nation's highest rated HIPAA compliance solutions, Bridge Compliance. Erin, thanks for hosting today. Take it away.
Thanks, Gary. And thanks again to everyone for joining us today. I really appreciate you taking the time. So I like to think about compliance as one of those things that most of us can appreciate and anticipate that we didn't really think we would spend this much time on as an adult. It's kind of like when we think about those posts that we see on social media, what occupies so much time as an adult that you didn't really anticipate. And I definitely feel like compliance is one of those, especially for healthcare providers. Anyone in a healthcare office is most likely going to spend the majority of their time working in a space that is touched by HIPAA in some sort of way, if not all of their day-to-day functions. At Rectangle Health, we work with some of the most trusted partners within healthcare compliance. So many of you that have joined today might have heard of us, and we work with tens of thousands of practices across the country to get customers up to speed on compliance and really help them own their own compliance programs. We strive to educate and empower these practices, and we work with hundreds of societies and technology partners to accomplish this. We have quite a wide reach in terms of the companies that we work with in comparison to others that work in a similar space. And so again, just a quick intro about me. I'm the Compliance Product Manager at Rectangle Health. So I work with our customers and our support teams across various stakeholders to identify the needs and opportunities for improvement for our compliance product, whether these are updates required by changes in federal regulations or opportunities to enhance and streamline our processes for a better user experience. From there, my team and I create solutions that you see in our platform today. Starting off with our agenda and HIPAA basics, we'll talk about safeguards to follow and how to look for ransomware and data breaches that can affect your practice. We'll then look at incident reporting and emergency planning as a means to prevent and mitigate vulnerabilities or risks. Lastly, we'll wrap up with some tips and free resources that you can use within your own practice. Since we're talking about HIPAA laws today, I wanted to start by putting up this disclaimer. By no means do I expect you to be able to read all of this teeny tiny print, let alone finish it before I advance to the next slide, but rather use this as an analogy as how we oftentimes have compliance issues, and it means a lot of information is being thrown at us at once. And we often have to address that in a timeline that is probably a lot faster than we would like. So again, our goal for today is to not let you, is for you to leave here today with information that makes those situations much less intimidating than the fine print we see here. While HIPAA does include many clearly defined rules and requirements, There is often flexibility for a practice to execute those in a way that aligns with their business needs, as long as the end result is secure and protected patient information. HIPAA, or the Health Insurance Portability and Accountability Act. For some background information, if you weren't already aware, this is enforced by OCR, or the Office of Civil Rights, which is a department within HHS. The first round of HIPAA rules and regulations came around in 1996, and this was an effort to reform healthcare in the United States by reducing costs, simplifying administrative processes and burdens, along with improving privacy and security. This was especially well timed because at this point, technology, especially the internet, was just starting to revolutionize how everyone was doing business, healthcare included. The increased adoption in technology led to significant additions that came around in 2013 with the Omnibus Rule, which standardized how we do business online and the threats that come along with that. Prior to the introduction of HIPAA in 1996, there was little to no standardization of requirements as to how healthcare organizations use and monitor patient information and data. This included how patients access their own information. And this is a piece that I find especially important in HIPAA, and I often see it brushed over if mentioned at all in trainings. HIPAA isn't just the responsibility to protect information, but it also includes patient rights to access their own medical records. I like to mention this because everyone here today isn't just a healthcare provider. We're also consumers of healthcare in some way outside of work, whether it's at our PCP, our dentist, physical therapist, whatever it might be. So these aren't just rules that govern how we think about privacy as a provider, but things we should all understand as a recipient of services ourselves. I like to take a moment to call that out because I can find it really helpful in keying into the importance of these requirements. Like the ethics of reciprocity, or the golden rule as some might call it, treat others the way you want to be treated, or protect data the way that you would expect your providers to protect your data. Some of the false HIPAA misconceptions we see and why we recommend that practices be diligent in thoroughly reviewing their compliance program regularly and addressing gaps that might exist, you see here on the screen. So compliance isn't just a one-man job. While we see that IT, practice management, or EHRs, insurance policies, or office managers might all play a role, the responsibility of ensuring a practice stays compliant can't fall on the shoulders of just one person. Compliance requires a culture, which by definitions is a set of shared beliefs, behaviors, and practices that define a group. Emphasis on the word group here. We should be expecting that everyone we've required to adhere to our compliance program shares the same beliefs and behaviors when it comes to compliance. This sort of alignment is going to require everyone involved to be part of regular review and grooming of that culture to ensure it's in tip-top shape. So when we talk about the base of HIPAA compliance programs, what exactly does that mean? What is OCR looking for? And I preface this in saying this list here is not exhaustive, but will provide a foundation for compliance. I want to encourage everyone to take this opportunity to reflect on your practice's own approach and what rings true for how you do things today. For example, do you have a more structured training plan in place where everyone is trained at regularly scheduled intervals? Or is it more of a casual program where one person isn't designated to take charge, or people are just trained when issues come up or you see fit? Or when we talk about risk assessments, is this non-existent maybe, or was one done a couple years ago and it's accumulated some dust on the shelf, versus this is done annually and previous versions are being archived for reference at a later date, and you're able to track your progress in addressing issues as you go throughout the years. And then the last item here isn't necessarily something you'll find in the CFR, the Code of Federal Regulations, that OCR adheres to, but in my opinion, is just as important. And again, it's going back to that culture of compliance. Do we do our best, assume it's common sense, and that our staff know what to do? Or do we ensure that we're utilizing legal advice, compliance experts, and appropriate resources to foster that culture of compliance and ensure that everyone has a mutual understanding and adheres to their responsibilities. PHI, or protected health information, is one of the primary tenets of HIPAA rules. But what exactly does that mean? Well, PHI is any sort of individually identifiable information. And thanks to the omnibus rule, this applies to all forms of PHI, both hard copies, verbally communicated, and electronic, or what we might refer to as ePHI. Here we have a list of things like name, social security numbers, addresses, or other identifiable characteristics and codes. The case can be made that these elements can be found in just about every inch of a patient's chart. This also includes all the elements that someone might need in order to steal another person's identity. And this is the key reason that we see so many security incidents in the healthcare space. When it comes to HIPAA training requirements, right out of the gate, staff should be receiving some sort of training on your HIPAA policies, procedures, and this should happen within a reasonable amount of time from the start of their employment. If your offices are anything like my previous employers, your staff might meet with HR or their supervisor briefly their first morning, and then it's basically right into shadowing one of your current employees. With shadowing, there is almost certainly going to be an opportunity to start coming into contact with PHI right away. So it's important to train as soon as possible, then annually thereafter, or whenever another need is identified. Employees should also be acknowledging they understand and have completed their training. And this training should be modern and relevant to your practice. So if you're 100% electronic at this point, but your training still reflect information about paper charts or things like that were being used 10 years ago, then that content needs to be updated to reflect your current processes. This training can be completed online or in person. There's pros and cons to both, right? So online allows more flexibility, being able to assign trainings to staff that they can complete when they're available, versus in person involves taking everyone off the floor, what costs and loss in revenue might be associated to that, all things to consider when looking at how to implement your compliance program in a way that suits your office. When we say HIPAA, we're usually referring to 3 different segments of rules for how to manage and protect patient information. The first rule that we'll talk about is the privacy rule, which you may know or have guessed by now is how we ensure the protection and privacy of patients that you serve. Much like many federal requirements, HIPAA can be confusing at times, so let's try to break it down. As part of the privacy rule, another rule to consider is the general rule. So while the privacy rule does revolve around how to protect ePHI or PHI, there is a level of disclosure that may be needed to maintain continuity of care. So we have specific rules in place to maintain confidentiality in the process of those disclosures. Generally speaking, disclosures should always be authorized in writing with the specific terms in which the disclosure can be made or what type of information can or cannot be disclosed. For example, a patient may sign a release of information for your office to send records to another provider that maybe you've referred them to, or they might be relocating to. If you're ever unsure, it's always better to have a release signed. Having one signed when you don't need it has no consequence, while not having one signed when you should would constitute an unauthorized disclosure or information shared. There are situations when written authorization is not required, however. Maybe the most obvious one being disclosures to the patient. So we can share information during the normal course of a visit, but they also have the right to request copies of their records, as well as an accounting of disclosures, which is when your office has shared their information. For example, the release you completed to send records to a patient's new provider, once those records have been sent, that should be logged as a disclosure, and the patient has a right to request that log. Another scenario is instances of what we call treatment, payment, and healthcare operations. So these are things like coordination of care or consultation between doctors, disclosures for the purpose of receiving payment, or other healthcare operations such as audit, insurance processing, or billing. When it comes to family involvement, a patient can agree or object to involving their family in care. In cases involving parents of minor children, this might vary by state. So it's important to know what your state specifies as the age of consent for minors when it comes to healthcare and their patient rights. Lastly, we have incidental disclosures. So when we're in common areas, it's especially important to consider what the minimum necessary is. The minimum necessary refers to the concept of disclosing only the minimum amount of information needed in order to satisfy a request. For example, at time of check-in, a front desk staff would need my name and maybe my appointment time or doctor. So while a patient might tell you they're here for a follow-up on the root canal they had last week, the front desk staff doesn't need to know that and most certainly shouldn't be asking for that, as there are likely other patients around within earshot. This concept applies to all types of disclosures as well. So it's really important to keep in mind whenever releasing information, what the minimum necessary is in order to satisfy the request. The second rule we'll look at is the HIPAA security rule. So as you may have already inferred, the security rule is all about our best efforts to keep information safe. This consists of 3 types of safeguards that we should have in place. The first one being administrative safeguards. So what types of policies and procedures do you have in place? These include both processes to prevent any sort of lapse, as well as how to react if something were to go wrong as it relates to the security of patient information. Next are technical safeguards. So in this day and age where almost every piece of patient information is stored electronically, what do you have in place to ensure proper access is granted and improper access is denied? This also includes what sort of protections are in place on your machines, such as email encryption services, firewalls, and so on. And then lastly, physical safeguards. So while technical safeguards protect the intangible, for lack of a better word, our physical safeguards protect the tangible. So how do we monitor access to buildings, records rooms, IT rooms, etc.? All covered entities must have a compiled binder and either physical or electronic. This is one of the general rules for policies and procedures. This must be specific to an organization and updated as either the process or policies change over time. This should include copies of privacy, security, and breach notification policies, staff training guidelines, business associate agreements, patient forms, such as your notice of privacy practices, your HIPAA risk assessment, privacy and incident documentation, as well as asset logs. If a certain OCR required policy isn't applicable, then documentation as to why it doesn't apply should also be included here. And lastly, this must be accessible for reference by all employees, which might inform your decision as to whether or not you go with electronic or hard copy, whichever works best for your business practice. All right, so that brings us to our first polling question, which Gary will launch for us.
All right, folks. First poll question is, which of these is not one of the 3 key HIPAA safeguards? Physical, office, technical, administrative. Aaron will just give them about 10-15 seconds for everybody to get a chance to respond here. And I'll kick it back over. Results are still coming in. We're going to close it up in 5 seconds. All right. Sharing the results now. Looks like 25% said physical, 48% said office, 11% technical, and 16% administrative. Aaron, what's the answer?
All right, that's great news. So it looks like the majority of you got this right. The one that is not a HIPAA safeguard is office safeguards. So our 3 are administrative, technical, and security. I'm sorry, administrative, technical, and physical. Looking at my notes here, jumping on to our third HIPAA rule that we'll talk about today. And that is the breach notification rule. The breach notification rule outlines everything that needs to be documented and happen in the event of a breach. So we first need to know what happened and what was compromised and how this happened. Patients also have to be notified in the event of a breach, and this should occur within 60 days of being aware. In certain scenarios, media notifications and resources must also be set up depending on the number of affected individuals. HHS also has to be notified, which again varies depending on the number of individuals, but it's important to understand those timelines. So records where there are more than 500 patients where records were compromised, those have to be reported without delay to HHS. Those with less than 500 have to be reported within 60 days of the start of the following year. In the event of a substantiated breach, there is potential for penalties under a 4-tiered fine structure. The first tier is situations where there was no knowledge of the breach and we demonstrated reasonable diligence. So this might be something like a patient overhears a provider discussing treatment related to someone else. Although the providers took precautions to speak in a secure location, the conversation was still somehow overheard. Second tier, somewhat similar in that the violation couldn't have been avoided, but the provider should have been aware that this occurred. The third tier is a violation that occurs directly as a product of willful neglect, and correction is completed within 30 days. So maybe they failed to implement proper policies and procedures or provide training, but they didn't state necessary safeguards after this was made aware, and hopefully that will be prevented moving forward. Tier 4 occurs when there's willful neglect and no attempt has been made to correct the violation or cause within 30 days. We all likely think that we're good. Maybe we did our research when we first implemented our compliance program. Our employees are seasoned and know what they should be doing. But the key to these lower tiers isn't just about putting in the work up front. It's the continued review and reasonable due diligence that an auditor would be looking for in the event that one of these scenarios came into question. So again, taking it back to the fact that we're not just providers, but we're all consumers as well. I would expect the offices handling my PHI are also taking this into account when handling my information. So what does due diligence look like? It's having a program in place that's made up of all the pieces that we're talking about today. A structured plan and training, designating a compliance officer, having an accessible HIPAA binder, including an emergency plan that encompasses 2 sorts of planning required, both contingency, which is how we maintain operations when things are maybe taken offline and ensure that that's secure, and an incident response plan for how we respond to a breach of this nature. You might also be getting tired of hearing me on this one, but the concept of a compliance culture. While this isn't something you can necessarily pull out of a filing cabinet to show an auditor, I guarantee you if your practice has it, it will shine through all of these areas that we've discussed. Even if a breach occurs, only one of these things lacking or missing in your entire program could open you up to an audit. Next topic that we'll be looking at is our business associates. So what is a business associate? This is a person or entity that performs certain functions or activities that involve the use or disclosure of protected health information on behalf of or provide services to a covered entity. These would be things such as your practice management system, your EHR or software provider, other IT providers like cloud storage, data backup, outside legal or claims processing providers as well. Those that would not be considered a business associate are things such as janitorial services, courier services, or your own employees. As providers, you are all what's referred to as a covered entity and are most likely sharing information with business associates. The most straightforward example of this is your practice management software or EHR, electronic health record. A very common workflow would be that your patient presents at your office, signs their consents, notice of privacy practices, and any other paperwork that your services require and that you provide. And then this is documented in your PMS or EHR. Now, since that information is likely stored in their database of the PMS or the EHR, they inherently have access to your patient's PHI. And because this is a function of your business, this is needed in order to provide care. So it falls under what we refer to as treatment payment and healthcare operations. So you don't need written consent from the patient. However, you do need written agreement with your PMS or EHR that the business associate is following the outlined terms and they have access to your EHR or PMS, and this supports your business process. Similarly, this type of agreement is needed with your IT company that might be backing up that data, and the folks that come to pick up your shred bins because they might be coming into contact with PHI during the course of their services. While HIPAA rules have certain sections that apply to business associates and that they're expected to follow, this written agreement protects your organization in the event a business associate isn't holding up their end of the HIPAA roles and responsibilities. Like in the next few examples, it'll say, hey, if you have a breach, we're not responsible. So that's on you to ensure you're upholding everything that is expected based on the various HIPAA rules. And so one of these examples is North Memorial Healthcare. They were contracted with an IT company, and one of the employees at that IT company had their laptop stolen. So these services fell under the umbrella of what we would call a business associate or under a business associate agreement. And let's just take a look at the article here. So they had to settle 1.5 million in disclosures because of this employee worked for a contract company, had patient information on their laptop that was stolen while they were working out in the field or whatever it might be. And as a product of this breach being reported, OCR found that they had failed to implement a business associate agreement, and they had also failed to complete a HIPAA risk assessment. So it's possible to say if they had done a HIPAA risk assessment, they might have realized they didn't have a proper BAA in place, and potentially this disclosure could have been prevented. So when are business associate agreements not required? So we talked a little bit about this already, but business associate agreements aren't required for things such as janitorial services, other covered entities. So if we're coordinating care across providers, things like laboratories, other services that might be needed to ensure that a client is receiving proper care, those are situations where we might not need a business associate agreement. Another one are employees that are directly employed by your organization. They're providing work on behalf of your organization and also do not need a business associate agreement. That takes us to our second polling question.
All right, everybody, the polling question is up on your screen. Which of the following is not considered a business associate? Your landlord, your IT provider, your software provider, or all of the above? Give everybody a few seconds here to respond. And folks, while this polling question is up, any questions about HIPAA compliance, please direct them to webinar@rectanglehealth.com. We will reply as soon as possible and get back to you with everything you need. Thanks in advance. Aaron, looks like we have an overwhelming answer here. Give it another 5 seconds before wrapping it up. Awesome. And the results are in. 75% your landlord, 1% your IT provider, 2% your software provider, and 23% all of the above. Aaron, you want to give them the answer?
Yeah, this is great. I like to see that 75% of you were correct. The correct answer here is your landlord. So your IT provider, software provider are likely coming into contact with EPHI in some way or another. So your landlord would not have access to your electronic records, shouldn't have access to any hard copy records either. So that would be the correct answer there, is A, your landlord. Great. Shifting gears a little bit, we'll start talking about cyber attacks. So breaches can happen in many different ways, from human error, malicious intent, cybercrime, or theft. Let's take a look at the OCR breach portal, because as I mentioned earlier, any unauthorized disclosure is going to have to be reported to OCR. So give me just a sec. I'll get this pulled up here. All right. So as you can see, there's a mix here. We have the type of covered entity. For the most part, we see healthcare providers, but there's also a wide range of business associates. So going back to that idea that it's really important to have those agreements enacted so that that responsibility solely falls on the business associate in situations where they haven't done their due diligence to properly maintain your patient data. This is most common through network or other hacking incidents. So if we look at the type of breach, IT hacking incident, overwhelming majority here. We have some unauthorized access or disclosure or theft, but the number one way that information is being misused is through some sort of hacking or IT incident. And this can happen to organizations of any size, big or small. So it doesn't just happen to, the Change Healthcares of the world that was all over last year. I mean, people are still picking up the pieces from those types of incidents. This can be smaller organizations. So there's definitely no one's safe, I'll put it that way, in terms of where this can and can't happen. And they're happening more and more frequently. So just because the vast majority of things that we hear are the major providers in the industry, it doesn't depend on just size. So we want to make sure that we're doing our due diligence to address this where we can. Those are obviously the ones that'll get media attention, but this information is being compromised across different providers. Get my slides back up. Okay. So it's important to protect all medical data. This is extremely valuable information. When it comes to selling this information, it can be anywhere from 90 cents for a social security number, $1.25 for a credit card. And those are kind of the small players in the game, right? Because when we talk about healthcare records, these can sell for up to $10,000 per record. When we think about healthcare records, much like we talked about earlier, is composed of pretty much anything that would be needed to steal someone's identity. They often have a complete demographic record, and that is often accompanied by a financial record. So if we do quick mental math, $10,000 for all the patients that exist in your system, that's going to add up really quick to a bad actor who wants to infiltrate your system and try to acquire some of the information that you have stored. Another great way to ensure that we're protected against these types of incidents is to offer services like email encryption. So one way to protect, this also covers you to ensure that any type of information you're rightfully sharing ends up with the proper party. So regardless of your email service, no base service is providing the proper protection when it comes to email encryption. Additional safeguards are needed to ensure that these emails require some sort of authentication to open, if the email has ePHI in it, and without it, it's susceptible to interception and could possibly fall into the wrong hands. Another common way that a breach can occur is through phishing. So let's take a look at this email here. I hope we can see that. It's a little blurry on my end. Hopefully it looks better on your end. But here we have an email from PayPal. It's saying, this is your invoice. The billing department is invoicing you for $600. It's due upon receipt. There's evidence that your PayPal account has been accessed unlawfully for $600 and has been disabled. It's asking you to either call them or click here to view and pay the invoice. So first we want to look at the message is a note from seller. So we can see that the email address seems somewhat somewhat useful, but not entirely. This is emailed to me, and it's saying that this is a note from the seller to create some sort of false sense of urgency. This is a very common technique. Next, they say, you can call our number to continue this, and they hope that you'll reach out to that number so that they continue to collect information from you and just build upon the data that they have to perpetuate their scam. So this seems easy to spot when we sit here and dissect it on a webinar about compliance and security, but it's important to remember that once we're back in our normal routine, where our to-do list is piling up and we're trying to hurry through our day, we might be getting bombarded with emails like this. So even when we're working our quickest, we need to slow down and be thoughtful about what sort of content we're engaging with in our email. Questions that look even the slightest bit outside of your normal traffic, hopefully your organization has a mechanism in place to report that as a phishing attempt, or at the very least, delete that email or move them to your junk folder. Phishing also isn't just for email anymore. We're seeing more and more that scammers are using texting to try to acquire information like this. So here we have a text asking if we've requested a password reset, respond cancel, and plus to verify the code. And then we have here a verification and the code to complete this. So be sure to never share multi-factor authentication codes outside of the normal process. Apps shouldn't be requesting this, and this is likely an attempt to gain access to your account. And in this one we see here, it says to cancel. Even in scenarios where it says cancel or stop, this can give them the information or validity they need. Sometimes these scams are purely just looking for a certain number of accounts to engage with them so that they can gain some credibility with the wireless providers. And then further on down the road, implement more sophisticated scams. So even just responding to or acknowledging them can give them the information that they need to continue this on down the road. So what is ransomware? This is when someone is able to access your computer or larger network via some sort of malicious or unauthorized access point. And this might be via a phishing email or one of your employees open a more sophisticated hacking method. These attacks pretty much all follow the same pattern. So they'll lock you out of your system, say they have all of your patient's PHI, even if they don't. However, this can be very difficult to confirm. And that they'll be sold or posted on the dark web unless you pay them some sort of amount, typically requested in Bitcoin. And this has a lot to do with how we can train employees to not engage with this information. So much like we've talked about slowing down and looking at the emails that they're interacting with, the texts that they're interacting with, because they oftentimes have to be let in. So making sure that our training addresses this, and it'll save us a lot of headache down the road to go through an hour of training, as opposed to having to get your information back via a ransomware attack. Because this is a screen we never want to see, right? Your email or network has been compromised, someone's gained unauthorized access, pay us X number of dollars. So what if you've done everything you can, you haven't had any OCR fines, there can still be cost. And this cost can be increased over and over depending on the number of records or the type of attack that we've encountered. And so again, going back to the concept of training, taking the time to call this out for employees to hopefully save you some headache down the road. Pre-pandemic, averages for cybersecurity attacks were around $200,000. 2024 numbers have shown that this is almost doubled. And more than half of organizations are paying over $500,000 is the median cost, and some have exceeded $750,000 just to restore their data. And with most other things in today's world, we can likely assume that this cost will continue to increase over time. So is your practice financially protected? A cyber insurance security policy is not a requirement based on the HIPAA rules, but can come in extremely handy when you need it most. If your compliance program is up to date, then this can be a sort of catch-all and will ensure that any sort of costs associated to legal fees or restoration fees can fall under your policy. So it's important to double check if it covers that and if it will allow you to cover things like audit fines or employee errors. This takes us to our third polling question.
Awesome. All right, coming your way right now. Folks, what is true about ransomware? The payment of ransom is typically through Bitcoin. Email phishing is a common gateway to network access. Ransomware can encrypt or lock your data. Well, looks like the answers were rolling in before I even finished the question, but we'll give it a second here. This one's a scary one. People were definitely paying attention on this one. Awesome. Another 3 seconds here before I close it out. Awesome. And let's share the results. Looks like 2% said the payment of ransom is typically through Bitcoin. 3% email phishing is a common gateway to network access. 6% ransomware can encrypt or lock your data. 89% all of the above. Erin?
Great. Correct answer is all of the above. So yeah, we typically see all of these things in a ransomware attack. So great job to 89% of you there. The others were technically true, right? But we were really looking for all of the above. So good job. All right, our last topic for the day before we get into our quick tips. In the world of HIPAA, we have emergency planning, and this should consist of both your contingency plan and incident response plan. And this is the number one area that we see practices fall short oftentimes. Contingency planning is made up of 3 parts and outlines what your practice will do in the event of an emergency. So while these types of emergencies might be due to things like ransomware, this should also account for things entirely outside of your control, such as environmental hazards or natural disasters like wildfires, hurricanes, earthquakes that could potentially take your practice offline or drastically alter the way that you run it. For example, thinking back to the very early days of COVID when non-essential operations came to a halt, there were so many things to consider, like staggering shifts or limiting access to a fraction of people. Did this impact your office? And if so, was there an adequate plan in place, or did it become one of those things you just had to figure out as you went? If it's the latter, I'd venture to guess you prefer to not have to be in that situation again. And to be frank, you really shouldn't be, as those are the types of situations that we should be planning for in these 2 plans, because those are the situations where PHI is put at very great risk. So with these 3 pieces of contingency planning, the first one is having a data backup plan. This plan ensures that when disaster strikes, PHI is not lost or destroyed, and a viable copy of all PHI is created. And these exact copies of PHI can be restored. So this should include all forms of PHI, whether it's electronic, hard copy, whatever it might be. A disaster recovery plan should also be established, and these are the procedures that must be followed in order to restore access to data, including how files should be restored from backups, and a copy of the plan should be readily available and stored in more than one location. The third piece is an emergency mode. So when we want to be in emergency mode and the emergency mode operation plan must ensure that critical business processes continue to maintain the security of ePHI when operating in emergency mode. For example, when there's a technical failure or power outage, how do you continue to document notes, view the schedule to send out reminder calls, things like that. The goal of these 3 parts combined is to maintain critical operations and minimize loss. We want to define a time period, so what must be done during the first hour, day, or week. Also have a plan of activation, so what events will cause the activation of the contingency plan and who is the authority to activate this. Use plain language so that it can be understandable across all employees that might need to engage with the plan. and be able to communicate and share the role and responsibilities across the organization. This plan should also have established testing schedules to identify gaps and testing exercises where we can update the plan and monitor effectiveness. And then lastly, the plan should be reviewed on a regular basis or situationally as technical, operational, environmental, or personnel changes occur. In terms of data backup, it's good to practice or adopt what we call the 3-2-1 approach. So we should create 3 copies of data, store them on at least 2 different media types, or store them in at least 2 different media types, and have 1 copy stored securely offsite. Backup should also be tested to ensure the recovery of data is possible. Incident response planning is used to classify what a security incident is and what to do when an incident is suspected. This should also identify who is responsible for different actions in the event of a security incident. So how quickly is action needed? What roles and responsibilities need to be enacted? Who will contain, correct, or recover data that's compromised during an incident? A plan for documentation and communication of the plan, and then lastly, outline reporting requirements, both internally and externally, whether that's to internal stakeholders, reporting as needed to the actual patients, and then lastly, reporting to HHS or other external parties that might be required based on varying regulations. Which brings us to close to being wrapped up and going over our 10 quick tips. So we'll summarize some of the things we talked about today. First one, making sure that we have our HIPAA policies, procedures, and plans all updated. So this should be done at implementation of a compliance program, and best practice is to review these annually to ensure they're applicable to your current requirements and business processes. Making sure that we document how PHI is accessed and secured. So who has access, how are they getting access, and how are we releasing that information? Obtaining business associate agreements when applicable. So any contractors that you might be working with who have access or need to view PHI in order to maintain business operations, those should be documented in a business associate agreement. Documenting our compliance progress. So every year when we're doing our risk assessment, identifying our gaps, and then continuing to update and speak to how we're addressing those, how we're improving those. So year over year, we're seeing progress. Not sharing information without authorization. So again, best practice is to obtain a release if you need to communicate information outside of treatment, payment, and healthcare operations, and making sure we have proper authorization. Training employees on the dangers of cyber attacks and phishing attempts. So like we talked about, these are some of the most common ways that bad actors gain access to our systems and patient information. So making sure that staff are up to date. Planning for emergencies. No one's exempt, whether this is a natural disaster or a cyber attack. They don't discriminate against practice size, number of employees, your annual revenue, whatever it might be. We're all prone to this. So planning for the worst and hoping for the best. Look at a cybersecurity insurance policy. So seeing what would best suit your practice and your needs so that if you do everything you need to, yet something still happens, you have some coverage there. Regularly review your training and train staff on the HIPAA compliance requirements and securing protected health information. So again, fostering that culture of compliance is going to rely on keeping staff up to date and informed, which I think is actually our last tip as well. Yes, so creating a sense of compliance and a culture of compliance, involving everyone, keeping them up to date through trainings, policy updates, whatever it might be, keeping it on the forefront of our mind so that when something does happen, we have a way to address it and speak to it and hopefully prevent the worst. So with that, I will hand it back over to Gary. And thanks again, everyone, for your participation today. We really appreciate it.
All right, Erin, thanks. Thank you for a great presentation, folks. That concludes the CE portion of the presentation. And just before we wrap up here, just a few reminders and housekeeping items. Aaron, you can move to the next slide for me. So, great information from Aaron. What's next? To help identify gaps and vulnerabilities in your practice of compliance and cybersecurity, Rectangle Health has a free HIPAA gap assessment that we invite you to take. That link is in the chat here. Some of you have actually seen it in the invitation emails before, when you registered. I believe 11 have completed, 16 started, so great work there. Again, that link is in the chat. It takes about 15 minutes, and the best part is when you take the assessment, get your results, you do not have to decipher them. A compliance expert will reach out, help you assess and tackle the priority items for both protecting both your patient and practice data. Our next slide, please. So after that, if you want, uh, at the top of this webinar, we spoke about bridge compliance. Before I get into it, maintaining HIPAA compliance all the way through from from payments to engagement, sending those text message reminders, what to include, what not to include, managing OSHA compliance, managing cybersecurity. How do you get there? And that's with bridge compliance. Aaron, next slide, please. So what is it? It helps you live stress-free or a little bit less stress-free, digitally managing that HIPAA and OSHA compliance, as I mentioned, ensuring your EPHI is safe, maintaining a safe workplace, reducing that time-consuming process, again, taking the complexity out of compliance, uh, allowing the system to take 95% of the lift off of you and avoiding those costly compliance gaps and avoiding penalties as well. I have a link to schedule a demo. It's a short conversation again with a practice solutions consultant to get you started, see what the system's about. Does it fit in with your current tech stack? And again, it's all about lifting that stress off your shoulders and allowing the system to navigate those day in, day out compliance requirements. Next slide, Aaron. And again, HIPAA compliance management, OSHA compliance management, PCI compliance management. You'll also have with Bridge Compliance access to more CE credits and cyber liability insurance. And now on to the housekeeping items, folks. As a reminder, CE credits will be emailed over to you within 2 weeks. Please be patient as we have a ton to process on this webinar. There's a ton of you on board. That will hit your email inboxes to the email address that you registered for this webinar with. And then last but not least, when this webinar ends, there's a brief survey, if you don't mind taking it, just to let us know how we did, how we can improve, what you want to hear next on our webinar topic schedule. We greatly appreciate it. And that's about it. So in the words of the great Matthew McConaughey, all right, all right, all right. That wraps it up. Aaron, thank you so much for taking the time to host this great training. And to all in attendance, thank you so much for joining us and have a great rest of your day, everybody.
Thanks, everyone.